A silent threat. 12 signs that could indicate irritable bowel syndrome, IBS. IBS, medically known as irritable bowel syndrome, is a common gastrointestinal disorder that affects a significant portion of the population. Characterized by a collection of symptoms including abdominal pain, bloating, gas, and altered bowel habits, IBS can significantly impact one's quality of life. Despite its prevalence, IBS is often misunderstood and misdiagnosed, partly due to the variability of its symptoms and its overlap with other digestive disorders. The exact cause of IBS remains elusive, but several factors are believed to play a role. These include abnormal movements of the digestive tract, heightened sensitivity to pain in the gut, imbalances in the gut microbiota, and psychological factors like stress and anxiety. Additionally, certain foods and beverages can trigger symptoms in some individuals, pointing to a possible link between diet and IBS. IBS is classified into 3 types based on the predominant symptom: IBS with constipation, IBS-C, IBS with diarrhea, IBS-D, and mixed IBS, IBS-M, which features both constipation and diarrhea. Understanding this classification is key in managing the condition, as treatments and dietary recommendations can vary based on the type of IBS one has. Though IBS does not cause changes in bowel tissue or increase the risk of colorectal cancer, its symptoms can be debilitating. It is estimated that IBS affects between 10% to 15% of the global population, with a higher prevalence among women. The condition is most commonly diagnosed in individuals under the age of 50. To address this significant health issue, I will outline the top 12 signs of irritable bowel syndrome in today's video, empowering you to recognize and take action against this silent threat. The first sign of irritable bowel syndrome, IBS, is recurring abdominal pain. This pain is typically associated with a change in bowel habits and can range from mild discomfort to severe cramping. It usually occurs in the lower abdomen and can be triggered by eating or relieved by having a bowel movement. Notably, this type of pain tends to come and go over time and is often described as a crampy sensation. It's crucial to differentiate this chronic pain from occasional digestive discomfort, as it's a persistent feature in IBS. Second, IBS often manifests as irregular bowel movements. This includes constipation, IBS-C, where stools are hard and difficult to pass, or diarrhea, IBS-D, characterized by loose, watery stools. Some individuals experience alternating bouts of constipation and diarrhea, IBS-M. These variations in bowel movements can significantly impact daily life, leading to discomfort and the need for frequent bathroom trips. Monitoring these patterns is key for both diagnosis and management of IBS. Third, bloating and excess gas are common symptoms of IBS. Bloating refers to a feeling of fullness or swelling in the abdomen, often accompanied by gas and discomfort. This symptom can lead to visible abdominal distension, causing embarrassment and discomfort. Gas production in the gut can also lead to embarrassing situations, further impacting the social life of individuals suffering from IBS. Fourth, a change in the appearance of stools is a notable sign of IBS. Stools may vary in consistency and form, ranging from hard, pellet-like stools to loose, watery ones. Mucus in stools, while not necessarily harmful, can indicate irritation in the intestines. This variability in stool appearance can be alarming and confusing for patients, making it important to track and report these changes to healthcare providers. Fifth, experiencing an urgent need to have a bowel movement is another symptom of IBS. This sensation can be disruptive to daily life and cause stress, particularly in situations where access to a bathroom is limited. The urgency is often unpredictable and can lead to anxiety about being away from home or in public places, further affecting the quality of life. Sixth, difficulty in bowel movements is also a sign of IBS, especially in IBS-C. Despite the urgent need to go, individuals may experience straining, a feeling of incomplete evacuation, or a sensation of blockage in the bowel. This can be both physically uncomfortable and mentally frustrating, as it feels like one cannot properly relieve themselves. Seventh, IBS can cause fatigue and lack of energy. While not directly related to the digestive system, these symptoms can result from the chronic stress and discomfort of managing IBS. Nutrient malabsorption or disturbed sleep due to gastrointestinal symptoms can also contribute to these feelings of exhaustion, making it difficult for sufferers to maintain their usual daily activities. Eighth, some individuals with IBS report difficulty sleeping or poor sleep quality. The discomfort and pain from IBS, particularly when symptoms flare up at night, can disrupt sleep patterns. This can lead to a vicious cycle where poor sleep exacerbates IBS symptoms, which in turn leads to more sleep disturbances. Ninth, IBS can be associated with food intolerances. Certain foods and beverages, such as dairy, gluten, carbonated drinks, and high-fat foods, can trigger or worsen symptoms. Identifying and avoiding these triggers is crucial for managing IBS. Keeping a food diary can help individuals pinpoint which foods exacerbate their symptoms and aid in developing a personalized dietary plan to manage IBS. 10th, IBS symptoms can be exacerbated during periods of stress or emotional upheaval. Stress doesn't cause IBS, but it can trigger symptoms or make them worse. This highlights the importance of stress management techniques, such as mindfulness, relaxation exercises, and therapy, in managing IBS. Implementing these techniques can help reduce the frequency and severity of symptom flare-ups. 11th, women with IBS often report a worsening of symptoms during their menstrual periods. This indicates a possible link between bowel symptoms and hormonal changes. The menstrual cycle can significantly impact the severity of IBS symptoms, making symptom management more challenging during these times. 12th and finally, nausea or a general feeling of being unwell can also be a symptom of IBS. While not as common as other symptoms, nausea can accompany flare-ups and contribute to a decreased appetite and weight loss in some individuals. This general malaise can further diminish a person's quality of life, making it vital to address these symptoms as part of a comprehensive IBS management plan. These 12 signs are key indicators of irritable bowel syndrome. Recognizing and understanding these symptoms is important for individuals who suspect they might have IBS. Early recognition and treatment can significantly improve the quality of life for those suffering from IBS. If you recognize several of the symptoms associated with irritable bowel syndrome, IBS, it's important to seek medical advice. The primary diagnostic tool for IBS is a thorough medical evaluation, including a detailed history of symptoms. Since there is no specific test for IBS, diagnosis typically involves ruling out other conditions that can cause similar symptoms, such as celiac disease, inflammatory bowel diseases, like Crohn's disease or ulcerative colitis, and gastrointestinal infections. This process is known as a diagnosis of exclusion. Blood tests, stool tests, and, in some cases, colonoscopy may be recommended to exclude other conditions. For instance, blood tests can check for anemia, thyroid problems, and signs of infection, while stool tests can detect parasites or blood. A colonoscopy allows for a direct look at the colon and rectum to rule out other causes of symptoms. The Rome 4 criteria are often used to diagnose IBS. These criteria include recurrent abdominal pain, on average, at least 1 day per week in the last 3 months, associated with 2 or more of the following: pain related to defecation, a change in the frequency of stool, or a change in the form, appearance, of stool. These criteria help ensure a standardized approach to diagnosing IBS. IBS is a common condition, affecting an estimated 10 to 15% of the population worldwide. However, only about 30% of people with IBS symptoms seek medical attention. This could be due to the nature of the symptoms, which some may find embarrassing, or to the misconception that these symptoms are not indicative of a serious condition. Treatment for IBS often involves a combination of medication, dietary changes, and lifestyle modifications. Medications may include antispasmodics to relieve abdominal pain, laxatives or fiber supplements for constipation, and medications to control diarrhea. Probiotics and mental health therapies such as cognitive behavioral therapy or hypnotherapy are also beneficial for some people. Dietary changes, particularly following a low FODMAP diet, can significantly reduce symptoms for many individuals with IBS. FODMAPs are certain types of carbohydrates that can cause digestive distress in sensitive individuals. A healthcare provider or a dietitian can provide guidance on how to effectively implement this diet. To address IBS, let's explore 8 lifestyle modifications that can help manage symptoms and improve overall gut health. The first lifestyle modification for managing irritable bowel syndrome, IBS, involves dietary adjustments, specifically adopting a low FODMAP diet. FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are short-chain carbohydrates poorly absorbed in the gut, often exacerbating IBS symptoms. This diet involves initially eliminating high FODMAP foods, then systematically reintroducing them to pinpoint specific triggers. Foods typically high in FODMAPs include certain fruits, vegetables, dairy products, and wheat. Adhering to this diet can significantly alleviate symptoms like bloating, gas, and abdominal pain. However, it's crucial to undertake this diet under the guidance of a dietitian to ensure it is followed correctly and nutritional needs are adequately met. Second, increasing dietary fiber intake is beneficial, especially for IBS with constipation, IBS-C. Introducing fiber gradually is key to avoiding gas and bloating. Soluble fiber, found in foods like oats, psyllium, and legumes, tends to be more digestible than insoluble fiber. Alongside increasing fiber, boosting water intake is essential to aid digestion and stool formation. This combination not only alleviates constipation but can also help regulate overall digestive function. It's important to note that some individuals with IBS may have a sensitivity to certain types of fiber, so personalized adjustments may be necessary. Third, regular physical activity is recommended for IBS management. Exercise helps reduce stress, improve bowel function, and enhance overall well-being. Suitable activities include walking, cycling, swimming, or yoga. Exercise not only aids in regulating bowel movements to alleviate constipation but also contributes to overall physical health, which can be impacted by IBS. Establishing a regular exercise routine can also have positive effects on mental health, an important aspect considering the stress and anxiety that often accompany IBS. Fourth, effective stress management is crucial for IBS. Stress can significantly worsen IBS symptoms. thus incorporating relaxation techniques into one's daily routine is beneficial. These techniques include mindfulness meditation, deep breathing exercises, yoga, or Tai Chi. Additionally, seeking psychological support through therapy or support groups can provide coping mechanisms for the stress and anxiety associated with chronic conditions like IBS. These strategies not only help manage IBS symptoms but also improve overall mental and emotional well-being. Fifth, maintaining adequate hydration is key in managing IBS. Drinking sufficient fluids, particularly water, helps alleviate symptoms, especially constipation. It's advisable to avoid caffeinated and alcoholic beverages, as they can worsen diarrhea and disrupt sleep. Good hydration also aids in the overall functioning of the digestive system and can help in the absorption of nutrients, an aspect that can be compromised in individuals with IBS. Sixth, consider incorporating probiotic supplements. Probiotics can help in rebalancing the gut microbiota, which can be beneficial for IBS symptoms. When choosing a probiotic, it's important to opt for strains that are specifically recommended for IBS and to consult a healthcare provider before starting. Probiotics can aid in regulating the digestive system, reducing bloating, and improving bowel regularity, making them a valuable addition to an IBS management plan. Seventh, ensuring adequate and quality sleep is important for managing IBS. Poor sleep can exacerbate symptoms, so prioritizing sleep hygiene is crucial. This includes establishing a consistent bedtime routine, creating a comfortable sleeping environment, and limiting exposure to screens before bedtime. Good sleep practices not only help in reducing the severity of IBS symptoms but also play a vital role in overall health and stress management. Eighth, practicing mindful eating is beneficial for IBS management. This involves eating slowly, thoroughly chewing food, and avoiding large meals, which can trigger symptoms. Mindful eating helps in identifying any food-related triggers and promotes better digestion. This practice not only aids in symptom management but also encourages a healthier relationship with food, allowing individuals to enjoy meals without the fear of triggering IBS symptoms. Implementing these lifestyle modifications can significantly improve the management of IBS symptoms. It's essential to personalize these recommendations to individual needs and preferences, as IBS varies greatly among individuals. Consulting healthcare providers to develop a comprehensive and tailored management plan is crucial for effective control of symptoms and improved quality of life. Left untreated, irritable bowel syndrome, IBS, can lead to various complications that can significantly impact one's quality of life. Chronic pain and discomfort, often associated with IBS, can lead to a decrease in life satisfaction and daily functioning. Furthermore, persistent symptoms like diarrhea or constipation can cause dehydration and nutritional deficiencies, respectively. These nutritional issues can lead to a range of health problems, including anemia and weakened bones. IBS is also closely linked to psychological issues. The chronic nature of the condition, coupled with its impact on daily activities, can lead to increased levels of stress, anxiety, and depression. The social stigma and misunderstandings surrounding bowel-related symptoms can exacerbate these mental health challenges, leading to social withdrawal and reduced quality of life. Moreover, IBS can coexist with other health conditions, such as fibromyalgia, chronic fatigue syndrome, and urinary bladder disorders, which can further complicate its management. The overlapping symptoms of these conditions can make it difficult to diagnose and treat each condition effectively. Interestingly, IBS shares symptoms with other gastrointestinal disorders like Crohn's disease, ulcerative colitis, and celiac disease. This symptom overlap can sometimes lead to misdiagnosis or delayed diagnosis, prolonging discomfort and potentially leading to inappropriate treatments. Advances in medical technology and research have significantly improved the understanding and management of IBS. High-resolution imaging techniques and enhanced diagnostic criteria have made it possible to diagnose IBS more accurately and efficiently. This has led to better targeted and more effective treatment strategies, reducing the time it takes for patients to receive appropriate care. Historically, IBS was often misunderstood and not taken seriously as a medical condition. In the past, patients with IBS symptoms were frequently dismissed or incorrectly diagnosed with psychosomatic illnesses. This lack of understanding led to ineffective treatments and a general lack of support for those suffering from the condition. Today, the approach to IBS is much more nuanced and patient-centered. There is a greater recognition of the complex interplay between the gut and the brain, and treatments now often include a combination of dietary management, psychological support, and medication. This holistic approach has improved the lives of many IBS sufferers. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.